KUGN News Talk 590.
Well, right now it is 34 degrees here at KUGN News Talk 590. It is 8:16 now. Our next guest is Dr. David Fryefield. He is with Willamette Valley Cancer Institute. They're located at 520 Country Club Road. Also, they have an office at Riverbend. Good morning, Dr. Fryefield. Thanks for joining us this morning.
Good morning, Storm.
Well, radiation treatment at the Willamette Valley Cancer Institute and Research Center just became more high-tech. Explain for us.
Well, we invested $2.3 million to bring in a Varian Trilogy linear accelerator. And it's a kind of a big machine, and it's pretty imposing to look at. But what's more important is what it allows us to do when we're giving radiation treatments.
Now, Dr. David Fryefield is a radiation oncologist. So what does it allow you to do, doctor?
You know, the name of the game with radiation treatments, with any cancer treatment, is to treat the cancer and do as little collateral damage as possible. And I think everybody knows that. And there's a lot of reputation out there about cancer treatments being so very difficult and causing side effects. And we're aware of that, and we've been continually moving forward over the last 15 years or so with being able to deliver the radiation treatments in a much more precise manner. The focus of the radiation is much tighter now. We can look inside the body and see where the target is each day, and all of those things work together to allow us to treat in some pretty tight spaces. If you think about a tumor being right next to the spinal cord, for instance, that's some pretty important real estate in the body. The spinal cord is really important for us, and so we'd like to treat the tumor and avoid the good tissues as possible. And that's true when we're treating in the kidney and the lung, the prostate. So it's important to be able to deliver the radiation precisely, and the Trilogy really advances our capability of being able to do that.
So this $2.3 million tool, what does it look like, Dr. Fryefield? Is something like an MRI machine?
You know, it's probably a little bit bigger than an MRI. It's sort of around the patients, but they're not really inside anything. And there's the head of the machine. That's kind of the business end, and that's where the radiation comes out. But then on each side of that, on one side is a device that will allow us to take X-rays, and on the other side is a mini CAT scan. Now, that doesn't actually do anything for the treatment, but that's called targeting. Because again, as I said, if you're going to treat the cancer, you have to know where the cancer is. And we're looking at the outside of the body. A lot of times those cancers are deep on the inside of the body. So we can take an X-ray, or sometimes we'll just do this mini CAT scan each day for targeting purposes. And that's another big part of the precision that we need.
Well, you mentioned treating cancer. How far will this new equipment go towards actually getting rid of the cancers that are in the body?
Well, we're actually doing a pretty good job of that right now, and it doesn't happen all the time. Unfortunately, if cancers spread beyond what we can reach with our radiation beam, then we're not able to. But that's kind of what happened since I've been here. I came here in 1984, and back when I started out, we were just scrambling, trying to cure a cancer. And then we got to the point where we could do that with some regularity. So then the radiation oncologist started asking, well, how can we still cure the cancer but do that in a way that causes much less side effects, much less permanent effects. So I don't know, that this is going to necessarily by itself cure more cancers, but we're able to treat more people now in these very tight, very precise places, and because we're able to do that, we're also able to give a little bit higher dose. So it's really hard to say, it's going to cure, this percentage more people. And we're still working on that in combination with chemotherapy and that sort of thing. But I think the really, really important thing on this machine is that it advances our ability to do what we've been doing, but to do it in a much safer fashion.
A much safer fashion with more speed, precision. So, Dr. Fryefield, is this something that you're hoping to get another one or maybe 2, 3, 4 more machines?
Well, we're in a high-tech world, and these machines are expensive, and they have a certain life expectancy. We know we're not going to be using this machine 30 years from now. Mm-hmm. So we're continually, saving, quite honestly, and we know that probably another 4, 5, 6 years from now, we're going to have to invest in another next upgrade on the machine, and it will probably be more expensive than this one. But the technology keeps moving forward. So, that puts some pressure on us because we have a responsibility to the community to maintain that technology and be able to say we have the latest right here in town. But it also is very exciting for us because we really are continually moving forward and making advances.
Well, looking into the future, any ideas of what's next in terms of treating cancer?
There's a couple things, and that's one of the reasons why we got this machine now, is that we're going to be able. It's going to allow us to do some things in the future that we're really not even doing today. They're not quite ready for prime time. They're still being investigated at the universities, but I think they're going to be available relatively soon. One of them is called gating. Now, what does that mean? Well, it turns out that inside the body, things don't just sit there. They actually move around. Every time you take a deep breath, our organs move, and it's a little disconcerting because you're basically hitting a moving target. So if you think about it, then when we set our radiation fields and that tumor is moving around, well, we have to either move with it, or if the tumor moves out of the area where we're giving the radiation, then the machine has to stop, and that's called gating. It's pretty advanced, and we're doing that on a very limited basis today, but I think we'll be doing that a lot more in the future.
Will this particular new tool, the $2.3 million tool, be used in all forms of treating cancer? It has the ability to treat superficial cancers like on the skin or something like that, which it has not been that difficult. You can see it, you can feel it, you can get to it pretty easily. But where this machine is really helpful is a very deep cancer. So think about in the middle of the chest, the esophagus, for instance, or deep in the lung, deep in the abdomen like pancreas, deep in the pelvis like prostate cancer. That's where this machine really has, it's kind of advanced technology helps us get to those areas and to have confidence that we're hitting the right spot and that we're not hitting all those adjacent organs.
Can all patients use this new tool, or do you have to be a certain weight or in a certain condition? No, it depends on when we're going to use radiation. In the world of cancer treatment, we have surgery, we have chemotherapy, hormone therapy, radiation, and so a lot of times we'll use a combination of different ones, maybe surgery and radiation, maybe radiation and chemotherapy. So there are some kinds of cancers where radiation is really not going to be an option for patients, but many others where it is. So it just depends on the kind of disease. There's about 250 different cancers, so it just all depends.
What about the cost, Dr. Fryefield? Would it cost more because you have to use this particular machine to treat a patient?
No. It for the patient and the insurance company, no, the cost is the same on that.
We are speaking with Dr. David Fryefield. He's a radiation oncologist at Willamette Valley Cancer Institute, 520 Country Club Road, also an office at Riverbend. So where is this particular machine used? Is it at your 520 Country Club Road office or at Riverbend?
The radiation machines are on Country Club Road. They take some special vaults, they're called. The walls of that vault are 7 feet of concrete. For, I guess, obvious reasons, we have to make sure that the radiation stays within our confines and doesn't affect our neighbors. And they were real nervous when we first moved in. We took some measurements just to assure them that none of the radiation was leaking out. But 7 feet of concrete is what's necessary. So these machines don't like to move around very much. They stand right here.
And if somebody is interested in learning more about this, should they just contact their own personal doctor?
Oh, I think that's always a good idea. Talk with your primary care physician, and if the primary care physician or if that patient thinks that they might need to come and talk with us, then I think talking to your regular doctor is always a good idea, and they can let us know if we need to see them.
Dr. David Fryefield, thank you so much for all you're doing. Thanks for sharing the details of this new incredible tool that you have at Willamette Valley Cancer Institute, and appreciate your time this morning.
Well, thank you very much. I appreciate it.
Yeah, you bet. We are KUGN News Talk 590. We'll take a short break. Be back with traffic.